Hi, and welcome to the Uconn Virtual Malnutrition Awareness Fair. My name is Rachel Woodruff, and I am majoring in nutritional sciences here at Uconn. Today I will be presenting on the relationship between malnutrition and immune function. I think this relationship is important to understand in the context of disease susceptibility and how we treat diseases with proper nutrition. So to begin, what defines malnutrition and immunity, and how do they affect each other? So malnutrition includes both over and undernutrition. It's a condition where the body does not receive the correct amount of nutrients. This can be seen in cases of obesity or starvation. And then immunity is the state of a body's ability to protect against infectious disease and pathogens. Malnutrition can affect immunity by either increasing the body's susceptibility to infection or lessening the capacity of the body's response once it is infected. Many studies show the strong connection between nutrient status and immunity, and current research continues to investigate the biological mechanisms of immune function that are affected by malnutrition. The immune system has many different defenses for detecting pathogens, ridding them from the body, and then preventing further infection. So we can divide this into physical, biochemical, and immune cellular categories. As for physical barriers, that would be epithelial linings such as your skin and gastrointestinal tract, as well as mucous membranes lining your open body cavities such as your nose. Biochemically, the body uses enzymes within body fluids such as your stomach acid, sweat, tears, saliva, and even your blood. Another biochemical defense is the microbiome. As for immune cells, most commonly known as your white blood cells, which includes macrophages, dendritic cells, T and B cells, and immunoglobulins. Your body also creates antibodies in response to the adaptive immune system to prevent further infection of the same pathogen. So we know that malnourishment, in terms of severe undernutrition, has been consistently correlated with suppressed immune function. In developing countries where malnourishment is a common health concern, studies have found that undernourished children die primarily from common illnesses, and a well-nourished child would usually be able to fight off these common illnesses. So this suggests that immunodeficiency is occurring. So as for why this occurs, in a malnourished child, their immune development is compromised, so the growth of their organs and just other immune functions. In adults, this can be seen by reduced levels of circulating immune cells, lymphoid organ atrophy, weakened epithelial barriers, and a lower gut immune response. Overall, these are all just changes that make the body more susceptible to infection. The human gut microbiome is a prime point of study when looking at the relationship between immune function and malnutrition. This is because it acts as a direct sensor to dietary change, because it comes in direct contact with the indigested food, particles, and environmental contaminants, whereas other structures like the gut epithelia are separated by mucosa and other chemical defenses. The microbiota have pathogen receptors on the microbial cells, which allow them to have nutrient sensing capabilities and signaling effects that impact immune development and function. So direct nutrient sensing is the ability of certain metabolites to control certain signals for things like intestinal immune development and immune responses. Micronutrient metabolites have been studied in the context of nutrient sensing, and one example is the role of vitamin A in immune signaling. So retinoic acid, the metabolite of vitamin A, can directly impact the ability of a lymphocyte to respond to an antigen and to arrive at the GI tract. This finding of immune control has been generalized for other micronutrients as well, such as iron, folate, zinc, and vitamin A, D, and E. Micronutrient metabolites also have the ability to control specific signals for intestinal immune development and other immune responses. In seeing how the microbiota is such a direct sensor of dietary change, it's not surprising to see the close relationship between diet immunity and the microbiota. This is a figure from a review article that assessed the role of the microbiota in immune function in inflammation. So it shows how each component affects the other in both directions of the cycle. In the context of malnutrition, a compromised diet will compromise the makeup of the microbiota. Again, as we looked at, the microbiota can determine how the body responds to a pathogen. So a compromised microbiota can compromise the immune system. And then a compromised immune system can affect how the body absorbs nutrients, which goes back to affect the diet. Limited nutrient and energy absorption amplifies the degree of immunodeficiency, and this whole immune degradation process is what happens in chronic malnutrition, which is why these malnourished individuals become increasingly susceptible to pathogens and continue to experience poor absorption of the nutrients they need. So to show how this information applies in a clinical setting, I have a case study from Stony Brook Southampton Hospital, which was provided to me by Paula Montegna, a registered dietitian and the director of clinical nutrition at this hospital. So the patient in this case study is a 61-year-old male who is in good health and nutritional status prior to his entry. His case shows how immune dysfunction relates to malnutrition and how the two can further distress each other to lead to severe cases of malnutrition and further disease susceptibility. So before looking at the details of this case study, I wanted to quickly show one important term, and that's C. difficile. This is a bacterium that causes inflammation of the colon and severe diarrhea. It's also referred to as C. diff, and the patient in this study became infected with this, which resulted in further malnutrition because they were unable to absorb nutrients in the body. So this case began in July when the patient came in and was initially diagnosed with diverticulitis. They had experienced some diarrhea and abdominal pain, overall a decreased appetite, increased tiredness, and abdominal bloating. Their weight was 215 pounds, and again, no previous medical history. They came back in August, continued to have diarrhea, and this time was diagnosed with C. diff, so a more extreme bacterium case. They had extreme weight loss and malnutrition. As you can see, their weight dropped to 165 pounds. Then when they came back in September, this C. diff and diarrhea had been ongoing, and because they had been experiencing this for 2 months now, the patient had severe depletion of muscle mass and body fat, and their weight had dropped to 145 pounds. In a case of severe malnutrition, as this patient experienced, the role of the registered dietitian becomes very important. So first, they assess the patient's nutrition risk and status by looking at their diet, appetite, and ability to absorb nutrients. So this patient experiencing diarrhea, not able to keep down meals, they were definitely determined to be at risk for malnutrition. So next, they determine the severity of that risk by doing a physical focus exam and adhering to certain criteria about the severity of the case. So after that, the RD will develop a personalized nutrition plan. For this patient at Stony Brook, Southampton, he was started on what's called a BRAT diet, which stands for bananas, rice, applesauce, tea, and toast. So all pretty easily digestible carbs just to try to get something in his system. They also shifted his diet to focusing on just replenishing water and electrolytes lost through the C. diff and diarrhea. And lastly, depending on how the patient tolerates it, they would move him towards recovery and trying to focus on higher protein and higher calorie intake to try to regain all that lost muscle and fat mass over the 2 months. This is the criteria that the RD used to assess the severity of the patient's malnutrition. So based on these guidelines, the patient was categorized as having severe protein-calorie malnutrition in the setting of acute illness. And this was evidenced by a few criteria, as you can see on the left. So weight loss, diarrhea, he had less than 50% energy intake for over 2 months, as well as the physical signs of muscle and fat depletion. And using this diagnosis was able to guide the RD's treatment and the diet that he was put on for recovery. So these are some pictures of what severe protein-calorie malnutrition would look like in a patient. Obviously, these are very extreme cases, but the bones become very visible. All that muscle and fat mass has been depleted. The patient is undergone severe weight loss, unable to absorb nutrients, and this is what can happen in those extreme cases. This case study demonstrates the interconnection between dietary changes with suppressed immunity and a compromised microbiota. So the patient with an initial infection of diverticulitis resulted in him having dietary changes due to decreased appetite, weight loss, poor nutrient absorption from the diarrhea. This suppressed his immune system, leading him more susceptible to the infection of C. diff, which further compromised his microbiota, made him unable to absorb nutrients, which again affected his diet, and you can see how this continued to cycle to a severe case of malnutrition that was observed. Based on all this information, here's a final recap of the relationship between malnutrition and immune function. So overall, it's important to know that malnutrition suppresses immunity by decreasing the levels of circulating immune cells, weakening epithelial barriers, and reducing the capacity of immune signals responses. Overall, it makes the body more susceptible to infection, and as we saw with the patient, further infection can lead to more malnutrition and making it harder for the body to absorb nutrients, which continues to cycle back and affect immune function. Understanding this interconnection of diet and immunity is essential for treating disease as a result of malnutrition, and further research will help develop better treatments and understanding how infections occur as a result of nutrition, and most importantly, how we can strengthen our own nutrition to prevent infection. In closing with my sources, I wanted to give a special thanks to Paula Montegna for helping me out with her expertise in the subject area and for providing me with the case study information that helped reinforce my research. And finally, thank you for watching and being a part of the 2021 Virtual Malnutrition Awareness Fair at Uconn.